Dr. Leisle, back with Dr. Leisle, a dentist from Fresno who treats children exclusively. Dr. Leisle, when should a mom start bringing the kids to the dentist, the young newborn, and for what reasons? And what should mom do at home in order to, kind of like build up, dental hygiene and make dentistry and taking care of the teeth normal to the child and not something which is a hassle or maybe even feared, has to be feared?
Well, thank you for asking that. We have such a thing called in dentistry anticipatory guidance. And what that means is that a parent bring a child in as soon as the child has her first teeth. That can be anywhere from 6 months of age up to, 12, 14 months of age. And the reason why you go in then rather than when they used to be doing at 4 or 5 years of age is that 50% of all 2-year-old children have at least one cavity. So we want to see the child before they are 2 years of age if possible. And it's just, if it's a 1-year-old, say around 12, 13 months of age, there's no x-rays usually taken. The child lays on the parent's lap and the dentist's knees so that the child can be seen and looked in the mouth just doing a visual exam. If a child is a little older, like 2 years of age, or say 18 months of age, and there's obvious cavities the parent sees, then the x-rays are usually taken because of insurance reasons and just to be sure that we can be totally aware of what's going on in the child's mouth. So an oral exam at the anticipatory guidance, say at 12 months, is not as involved as one that's older. And it's very important that, once again, as we've stated on another video, that the parent makes it a matter-of-fact visit. It's going to be fun. It's enjoyable. Because when they go to a dentist that treats just children, it's more of a fun time because the staff and the dentist are all used to having children in the office.
Okay, wonderful. Now, what should a mom take care of at home? What should she do or not do in order to, not make the teeth too rotten and, to alleviate pain and to do basically home preventive dental hygiene? What should she do and when should she start doing that?
Well, as soon as the baby should have like around 6 months of... I just lost my signal, Emmett.
You're here.
Okay, but can you see me? Okay.
Yeah.
As soon as the child is getting their first teeth through the gum, it's a good idea for the parent to start brushing them. Before the teeth come in, say like a month before, they can use a washcloth on the gums, but they don't want to use washcloth on the teeth because it doesn't really clean the teeth. When the teeth come through, like I said, it's a good idea to start brushing them. That can be 6 months of age up to a year, sometimes 18 months of age before they get their first tooth. So in brushing the teeth, it's very important that you do that in circles. And when I was a child, we used to do that up and down and back and forth brushing. That is not the way to brush the teeth to get all the food off. It's in circles, like a 5-10 circle count on each of the areas, both on the front sides and back sides, with a soft bristle brush. It's also a good idea for the parent not to lay the child down with a bottle and get them off the bottle when they're around 12, 13 months of age. The reason why is the milk or juice that's in that bottle can cause a lot of decay on the teeth. And then when they're about 14, 15 months of age, to come off the sippy cup, because sippy cups can be as destructive as a bottle can be. Lastly, there are a lot of parents, and I think it's a wise idea, doing breastfeeding. Breastfeeding is a great idea. They can do it up to 2 years of age. But once again, the child should not fall asleep sucking on the mother's breast while they're in bed. If the parent nurses the child's done in nursing, then it's time to put the child in the crib, but instead of the child laying in bed with the mom, because children that are on the breast can have as much decay as a child that's on a bottle if they're just laying there. And so it's the same issue as far as making sure that they're dislodged and they're in the crib, not with a breast or with a bottle.
I see. And the reason that is that if they're on the bottle or on the breast, there obviously then is milk in the mouth, and basically you're soaking the teeth in that milk, and the milk, well, that's like the reason we adults and everyone else has to brush is to get all the food rests off so they cannot eat away at the tooth. So, when you're with a bottle, you're not only not brushing, you're completely immersing the teeth in it, and especially with milk. Milk does turn fast, right?
Or juice. Oh, yeah.
Or juice.
Very, very bad. Yeah. After the first 6 months of breastfeeding, the breast milk changes, has a higher sugar content. So that's why that's very important there, too.
Okay. And what about if the teething starts happening and the baby starts crying? Is there anything out there which can alleviate that pain a little bit? Are there any gels out there? Is there something mom can do to help that out?
In our practice that I've had for quite a while, we don't find usually teething is a major problem with children now, and that's because of the change in brushing technique. When the parents are brushing well on the gums as the teeth are coming through, there can be some soreness, there can be some grouchiness on the child, is what they call quote-unquote teething, but generally that's minimal. Okay, but when the child is not having good oral hygiene, the parents only may be brushing once a day, sometimes only twice a day, then you'll find more of a problem. But what we recommend is the more you're doing that circular brushing, and you're doing it after breakfast, after the meals, after breakfast, after lunch, and before bed for a child that's before 3 years of age, they'll have less problems with the teeth coming through. Okay,
I see. All right. Well, wonderful. I appreciate this. I hope that the people watching appreciate it because, that's really good information. And like with everything else, it's getting used to it, just doing it natural, and then there is not such a problem with it. Thanks a lot.
You're very welcome.